Hello and welcome. My name is Osni Kenny, and today we will be exploring parental substance abuse and its implications in early childhood development. We will be exploring its effects in prenatal and infant development as well as in childhood and adolescent development. Furthermore, we will learn about parental substance abuse prevention and treatment. Substance abuse in parents is a significant issue shaping the growth and development of children in the United States. The consumption and abuse of alcohol, nicotine, marijuana, cocaine, methamphetamines, and other substances before, during, and after pregnancy brings short and long-term effects in children's development. According to the U.S. Department of Health and Human Services and the Substance Abuse and Mental Health Services Administration, approximately 12% of children in the United States live with a parent who is dependent on or abuses alcohol or other drugs. From 2002 to 2007, the National Survey of Drug Use and Health reported that 8.3 million children under 18 years of age lived with at least one substance-dependent or substance-abusing parent. Of these children, close to 7.3 million lived with a parent who was dependent on or abused alcohol, and about 2.2 million lived with a parent who was dependent on or abused illicit drugs. Nearly 10% of all births, approximately more than 400,000 infants every year, suffer substance exposure originated prenatally. State and local surveys have documented prenatal substance use as high as 30% in some populations. From 2011 and 2012, the National Survey on Drug Use and Health reported that approximately 5.9% of pregnant women ages between 15 to 44 years old were current illicit drug users. Younger pregnant women generally reported the greatest substance use, with rates approaching 18.3% among 15 to 17-year-olds. Between pregnant women aged 15 to 44 years old, about 8.5% reported current alcohol use, 2.7% reported binge drinking, and 0.3% reported heavy drinking. Some of the short-term effects of parental substance abuse include fetal growth anomalies, withdrawal, and issues in the neurobehavior of children. The long-term effects are comprised in the growth, behavior, cognition, language, and achievement of children's development. The behavior and interaction of parents with substance use disorders and their children influences the children greatly. The effects can be both indirect, for example, by providing a chaotic living environment, and direct through physical or sexual abuse. Parental substance use can affect parenting, prenatal development, early childhood, and adolescent development. It is important to note that not all children of parents with substance use issues will suffer abuse, neglect, or other negative outcomes. The substance use disorder of a parent may change his or her ability to function effectively in the role as a parent. Ineffective or inconsistent parenting can be caused by physical or mental impairments caused by alcohol or other drugs, reduced capacity to respond to a child's cues and needs, difficulties regulating emotions and controlling anger and impulsivity, disruptions in healthy parent-child attachment, allocating limited funds on alcohol and drugs instead of food or other household needs, devoting time searching, manufacturing, or using alcohol or other drugs, incarceration, which can result in inadequate or inappropriate supervision for children, as well as distancing from family and other social supports. Family life for children with one or both parents that abuse drugs or alcohol often can be chaotic and unpredictable. Children's basic needs, including nutrition, supervision, and nurturing, may go unmet, which can result in neglect. These families often experience a number of other challenges, including mental illness, domestic violence, unemployment, and housing instability that also affect parenting and contribute to high levels of stress. A parent with a substance abuse disorder may be unable to regulate stress and other emotions and can exhibit impulsive and reactive behavior that may escalate to physical abuse and provoke toxic stress in the child's environment. In addition to short-term changes in observable behavior, toxic stress in young children can indicate less evident and permanent changes in brain structure and function. The plasticity of the fetal, infant, and early childhood brain makes it particularly sensitive to chemical influences. Shonkoff and colleagues indicate the growing evidence of studies performed in animal and humans displaying the disruption of the developing brain architecture due to persistent elevated levels of stress hormones. Stressful experiences alter the size and neural architecture of brain areas and may lead to functional differences in learning, memory, and aspects of executive functioning. Furthermore, chronic stress is associated with hypertrophy and overactivity in areas of the brain such as the amygdala and the orbitofrontal cortex, provoking loss of neurons and neural connections in the hippocampus and medial prefrontal cortex. The functional consequences of these structural changes include more anxiety, prefrontal cortex atrophy, as well as impaired memory and mood control. The developing architecture of the brain can be impaired in numerous ways that create a weak foundation for later learning, behavior, and health. In other words, stress-induced changes in the architecture of different regions of the developing brain, such as the amygdala, hippocampus, and prefrontal cortex, can have potentially permanent effects on a range of important functions, such as regulating stress physiology, learning new skills, and developing the capacity to make healthy adaptations to future adversity. Sensitive developmental periods from first trimester rubella or prenatal alcohol exposure can create structural and functional disruptions that lead to a wide range of physical and mental illnesses later in adult life. As previously suggested, the effects of parental substance use disorders on a child can begin before the child is born. Maternal drug and alcohol use during pregnancy have been associated with premature birth, low birth weight, slow growth, and a variety of physical, emotional, behavioral, and cognitive problems. Research suggests that legal drugs such as tobacco, as well as illegal drugs, have powerful effects on prenatal and early childhood development. Fetal alcohol spectrum disorders are a set of conditions that involve an estimated of 40,000 infants born each year to mothers who drank alcohol during pregnancy. Children with fetal alcohol syndrome disorder may experience mild to severe physical, mental, behavioral, and/or learning disabilities, some of which may have lifelong implications, such as brain damage, physical defects, attention deficits, and others. Moreover, increasing numbers of newborns, approximately 3 per 1,000 hospital births each year, are diagnosed with neonatal abstinence syndrome, a group of problems that occur in a newborn who was exposed prenatally to addictive, illegal, or prescription drugs. The full extent of prenatal substance exposure is subject to different factors. These include the frequency, timing, and type of substances used by pregnant women, co-occurring environmental deficiencies, and the extent of prenatal care. Research suggests that some of the negative outcomes of prenatal exposure can be improved by supportive home environments and positive parenting practices. Children and teens of parents who use or abuse substances and have parenting difficulties have an increased chance of experiencing a variety of negative outcomes. Poor cognitive, social and emotional development, depression, anxiety, other trauma and mental health symptoms, physical and health issues, as well as substance use problems. Parental substance use can affect the well-being of children and youth in complex ways. For example, an infant who receives inconsistent care and nurturing from a parent engaged in addiction-related behaviors may suffer from attachment difficulties that can then interfere with the growing child's emotional development. Adolescent children of parents with substance use disorders, mainly those who have experienced child maltreatment and foster care, may turn to substances themselves as a coping mechanism. In addition, children of parents with substance use issues are more likely to experience trauma and its effects, which include difficulties with concentration and learning, controlling physical and emotional responses to stress, and forming trusting relationships. According to the U.S. Department of Human Services, while parental substance abuse continues to be a major challenge in our society, the past 2 decades have witnessed some new and more effective approaches and innovative programs to address child protection. For families where substance abuse is an issue, some examples of promising and innovative prevention and treatment approaches include promotion of protective factors such as social connections, concrete supports, and parenting knowledge to support families and buffer risks, early identification of at-risk families, and substance abuse treatment programs, and through expanded prenatal screening initiatives can be provided to promote child safety and well-being in the home through prevention services. Priority and timely access to substance abuse treatment slots for mothers, gender-sensitive treatment and support services that respond to the specific needs, characteristics, and co-occurring issues of women who have substance use disorders, family-centered treatment services including inpatient treatments for mothers in facilities where they can have their children with them, and programs that provide services to each family member. Recovery coaches or mentoring of parents to support treatment, recovery, and parenting. Shared family care, in which a family experiencing parental substance use and child maltreatment is placed with a host family for support and mentoring. Finally, parental substance abuse is preventable by avoiding smoking, drinking, and the use of prescription and illegal drugs before, during, and after pregnancy. Toxic stress can lead to potentially permanent changes in learning, such as linguistic, cognitive, and social emotional skills, behavior like adaptive versus maladaptive responses to future adversity, and physiology, as in the case of hyper-responsive or chronically activated stress response, and can cause physiologic disruptions that result in higher levels of stress-related chronic diseases. Public awareness of the effects of parental substance abuse is imperative for the healthy growth of children in strong and healthy families. Access to local and state programs, as well as access to trained practitioners, is necessary to identify at-risk parents and children to diagnose and treat substance abuse disorders. In summary, we have explored the effects of parental substance abuse and its implications in early childhood development. Additionally, we explored the parental response of individuals suffering substance abuse disorders and its impact in children, as well as the prevention and treatment of the serious issue of substance abuse influencing the health of our children. Thank you and have a great day.